is George Kobani. I'm the co-founder of DOCi Healthcare. I founded DOCi Healthcare about 3 years ago with my wife and a group of partners who are interested in improving the healthcare situation in Nigeria. Okay, essentially, DOCi makes healthcare more available to users. It creates more choices for users of healthcare. It creates easier accessibility for users, and it also empowers people and professionals in the healthcare space. So DOCi creates more options for users of healthcare. On the DOCi platform, you will be able to have more choice in terms of the kind of healthcare you receive. You can choose healthcare professionals by geographic location. You can choose healthcare professionals by gender. You can choose healthcare professionals by the specialization that you are looking for. Okay, DOCi is a personal journey, and a journey with a number of like-minded people like myself who have seen the challenge of accessing healthcare in Nigeria. About 3 years ago, a very close and dear neighbor of mine, next door neighbor of mine, passed away right in front of my eyes, simply because he could not have access to medical help when he needed it. I mean, a simple CPR procedure would have probably kept him alive up to this day. And at that time he passed away, he had 3 doctors within, I'd say, 50 meters of him. His next door neighbor, my wife, is a doctor. The house right beside his, had a specialist living there, and the next street beside his house, there was another doctor. 3 doctors within 50 meters, and none of them knew he was in this situation. And I began to ask myself, why can't we use technology to make healthcare more accessible? If my next neighbor had an app where he could have looked, or his wife could have looked for doctors nearby, they would have seen 3 doctors within shouting distance from him. But he did not know that these people were available to him, and nobody knew, and he passed away without that knowledge. And that was one of the things that got me thinking that if technology has solved so many other, even less crucial problems, why can't we use technology to solve something as important as healthcare? So it was a journey of lots of research, of asking questions, of asking why, why can't technology solve this problem? And that's how, DOCi was founded, as a means to use technology to increase healthcare accessibility. It's not just telemedicine. We want DOCi to be part of people's life journey. You go through a number of stages in your healthcare life. I would say, as a young man, you may have the limit of your engagement with healthcare is maybe going to get malaria drugs or going to the pharmacist to get Panadol. But by the time you get married, you now start to have kids, you now realize that from one stage to the next, you have different healthcare issues. By the time you're as a newly married person, you'll be thinking about reproductive issues. By the time you start to have kids, you'll be thinking about pediatric issues. By the time you get to middle age, you start to think of other lifestyle issues like diabetes, high blood pressure, weight issues. So it's not a transaction, it is taking you through the whole healthcare journey, and that's what we want DOCi to be that application that will take you through your life healthcare stages and through that journey of healthcare in your life. So you're talking about the number of doctors per population within Nigeria. I'm sure you're aware that there are thousands of doctors, Nigerian doctors, outside the shores of Nigeria that are providing fantastic healthcare in many countries. You're also aware that there's a huge population of doctors, Asian doctors, who are available. So what DOCi is trying to do, we are not limiting ourselves to doctors within the confines of Nigeria. It's an app. Anybody can sign up to the DOCi platform. Any healthcare professional around the world can sign up to DOCi to be a healthcare provider. So, but we are first of all looking at, as a foundation, Nigerian healthcare professionals. doing good work all around the world. Nothing at all stops them. In fact, there are a number of them that want to provide service within Nigeria, but they don't have the infrastructure or the means to. They don't have the availability or the ability to travel into Nigeria. But DOCi gives them that platform to sign up to a local platform where they can provide healthcare to people locally, but while being in the US, while being in the UK. So it doesn't limit, so DOCi's doctors are not limited to the confines of the availability of doctors within Nigeria. Okay, so the issue of having verified, qualified medical doctors is one of the biggest challenges in setting up DOCi. And what we figured out that we built a relationship with the Medical and Dental Council of Nigeria, based in Abuja, where we send so every doctor in Nigeria is supposed to be licensed and registered with the MDCN, and only MDCN certified doctors will be available on the DOCi platform. If you don't have an MDCN number, if you're not qualified with MDCN, you cannot be on the DOCi platform. So that working relationship with MDCN creates a situation where we send every doctor that signs up to DOCi to the MDCSN for verification. Security is also a very, very big concern of ours. Healthcare information is very, very valuable, precious information, and we appreciate this. And DOCi's security standards are in line with HIPAA, HIPAA standards. It's a US standards for confidentiality of medical records. So our security process are such that we guard patients' information, and even in our terms and conditions, we make them understand that this is the effort, or these are the steps that we take to ensure that their information is safe and secure with us. So we take it very, very seriously. Absolutely. Telemedicine is the future of healthcare. Technology has impacted on almost every single aspect of our lives, and healthcare is not going to be any different. But what telemedicine can, there are limits to what telemedicine can do. Telemedicine cannot run, a surgery. You can't, and even in a surgery, there are opportunities for telemedicine where other doctors can log into and watch and advise in a procedure, but there will always be that point where there may have to be some physical interventions, particularly with surgeries, particularly with some types of examinations. But telemedicine will or must be part of the healthcare journey for everyone. It's inevitable. So the question is, how soon are people going to make use of that benefit of telemedicine? So it's up to you really as a person. You can decide you want to go through the old method of always going to a brick and mortar hospital for a headache, or you can decide to make your life easier and use telemedicine for the basic and primary health consultations. I have a headache, I have a fever, or my child has a running stomach, what do I do? There are certain interventions and certain points at which you can access healthcare that does not require you to have to go every single time to a physical facility. So it's up to you to make that decision. At what point in time do you want to start using healthcare, telemedicine? Hello, my name is George Kovani. I'm the co-founder of DOCi Healthcare, and I'm on TechTalks on Guardian TV.